Hi guys, Dr. Joe here. So today what I'm going to talk about in my daily story is back pain. So as a chiropractor, this is something that we work on every day, and as it says, is 80% of the population does have back pain, either currently or previously in their health history. So it's a very common issue, and a lot of people do see chiropractors, physio, massage therapists, go to their family doctors, even the ER for extreme pain. So what exactly is happening with back pain? You bend over, you go pick something up, and you get this sharp pain, really sharp stabbing or stiffness, or you just feel locked right in your low back. What's happening? So we have our spine here, and here's our low back. There are 5 bones, okay, 5 vertebrae, and exactly what is happening in certain scenarios, obviously things differ based on what you're doing, but the most general form of back pain comes from the low back joints. And specifically, they're called zygapophyseal joints. I know that's a mouthful, but it's a pretty small joint, but it packs a punch whenever it does get irritated or whenever it's just not moving correctly. So we have multiple joints in our spine, okay, and we have these joints on either side. So we have one on this side here and one on the other side, okay? And these joints are supposed to open, they're supposed to move, they're supposed to gap, and that's what gives you your range of motion and your ability to move. But sometimes what happens is when you bend over, you pick something up, or you do something incorrectly, or maybe in a wrong position, one of those joints can just get lodged and they get locked. And the joint capsule, so picture like saran wrap that goes around the joint. So the joint capsule just holds in the joint, makes it really tight and stiff, and makes that joint become immobilized. So when that happens, you get sharp pain, and the muscles beside it become very tense, very sore, and it gives you this extreme pain, very excruciating. Hard to walk, hard to bend, deep breaths, movements, getting in and out of the car, getting up and down from a chair, getting out of bed. This all might sound pretty familiar for you if you've experienced something like this. It's very common. It does happen often, as I mentioned, but that's exactly what's happening for this specific type of back pain. There's a lot of types of back pain, but this is a common one, and this happens quite often where this area just becomes spasm and it locks, and that's exactly what it feels like for our patients. They just can't move. They feel very restricted and very locked in into their low back. So how do we treat this? Well, we have to first calm down the spasm into the joints and into the muscle. Some pain management is definitely key. And then the chiros, physios, massages, acupuncturists definitely do some work around the area to kind of decrease the pressure into the joint and allow for motion to be restored. So what happens is the area gets locked, but it's not going out of place. You might hear someone say, "Oh, my back feels out," or you go to a chiro or a physio or something, and they're like, "Oh, you're misaligned," or nothing's really being misaligned. Or something's out of place. That's a dislocation. Nothing's really being dislocated here. Nothing's coming out of place. What happening is just a locking of the joints, and the irritation of the joint is causing reduced motion, pain, and spasm, and it takes a while for it to release and to decrease its pressure. So again, nothing's coming out of place. It's just a locking of the joints, hypomobility, which means lack of motion, which is causing the pain and the problem. So if you've had back pain before, you could definitely relate. If you eventually may have back pain, which you may based on different moving characteristics that you may do, or just the nature of the back itself, I definitely recommend some core strengthening. Keep up with some stretching exercises, and planking is great. Sit-ups, if you have a back problem already, don't do sit-ups. If you don't have a back problem, then you could probably endure some form of sit-ups, but keeping the core nice and tight, and going to see a health professional, not only for pain, but for maintenance, to keep things in check. Okay, if you have any questions regarding low back pain, let me know. I know it's a very common topic and hot topic, so I'll answer your questions either through DM or send you another video directly. All right, thanks for watching.